Hi. Hi, Akshay. Hello, doctor. Hi, Vian. Nice to see you. Hey, good. Thank you. Hello, doctor. Good evening. Hey, Vian. Guys, hey, Glenn. Thank you for being there. Guys, if you're online, just comment below or just say hello, just say hi. We are looking forward to this talk. Yes, a lot of us are. This is a very interesting subject. It's something that we've all been wanting to hear and wanting to know. So I'm going to first take some time to welcome all of you. It's so nice to see all of you here. Thank you for your love and encouragement. I welcome you all to this wonderful talk with a very renowned doctor, and I'm going to share details of him very shortly, before which we are just going to wait for a few more people to come online before we start our live stream. That's nice to know. So, while we are at this, I'm going to ask you guys a question, okay? So tell me something. What does COVID-19 stand for? What does COVID-19 stand for? Anybody? Hi, Tony. Forum. Hey, nice to see you guys. Come on, guys. If you know the answer, I want you to tell me, what does COVID-19 actually stand for? We all know this word. We've been listening to it for the 100 last odd days. What does COVID-19 actually stand for? Okay, let me give it out to you, okay? So, CO is corona, VI is the virus, and D stands for the disease, and 2019 stands for the year that it originated, and that's where we have COVID-19. Yeah, so guys, we are here on the 4th episode of My Space with Michelle Gonsalves. We are doing a very interesting subject today. If you've been following me, you know that the last 3 times we've done various topics on different genres, on marketing, brand building, and we also had somebody from a radio jockey, Keisha Lobo, who gave us various tips on being a good RJ. So this space has been created for viewers to be encouraged, to be inspired, and to be motivated during this lockdown. And I'm hoping that we are fulfilling this objective to the rightful purpose that we've created this for. So yes, guys, before we start, I just want to give you the statistics of where we actually stand with COVID. Okay. So as of a few days, yesterday, the India cases were 6,48,315, with deaths amounting to 18,655. In Maharashtra, we had 1,80,298 cases, and the death rates were 8,053. In Mumbai, the cases are 82,074, and the death toll has gone up to 4,762. Now, this, friends, is such an alarming figure, isn't it? I mean, every day in the newspapers we are reading about situations, cases, and this pandemic has, I think it has not just brought death, it has brought individual losses, isn't that? Our jobs, pay cuts, layoffs, and this big lockdown that we are facing for the last 100 days or so. You know, I like this article that Shobha Day wrote about yesterday. She said, "We see our end in the death of these strangers." Now that line hit me like a lightning bolt. I mean, it's so scary to know that that I hope we never all eventually land up to that situation. And hence it was imperative for us to do this talk today with Dr. Swami Pawar. I am so very happy to have him here, and we are shortly going to allow him into this space. Yeah. So I'm going to read out a little poem on COVID-19, and I just want you to listen to it. So here it is by George. It says, "Some lay in coffins dead, some lay in hospital beds, some lay in the bed at home, some lay in the sun, some lay in the rain, some say they're bored. The world can use this extra time. The world can use this to catch a breath. The world can use this time to become more divine. The world can use this time to steer away from its death. People can use this time to reflect on life. People can use this time to experiment with new things. People can use this time to get to know their neighbor. People can use this time to look at the world differently. And although this pandemic is horrible, it will go and pass. Eventually, if we stay strong." Thank you. Thank you, everybody. And yes, I am now going to introduce my speaker. But before that, I want to say hello to all of you. Thank you for joining in. Thank you, Listra. Thank you, Ramchandra. Thank you, Eldridge. You've been such an inspiration to me. Thank you so very much for that love and for being here. Thank you very much. Thank you, Anurag. Thank you, all of you who are here. I'm now going to have Dr. Swami Pawar into this space, and we are going to get rolling with this conversation. Just give me like a moment. I'm going to shortly ask Doctor, and he's going to be right here. Hello, Doctor. Good evening.
Hello. Good evening.
And thank you so much. I just want to tell all of you here that Dr. Swami has been incredibly busy in the last 100 odd days. It has been really a crucial time for him, and I'm so thankful to you, Doctor, for giving us this time. I want to say we must salute all our medical professionals. They risk their lives treating COVID patients. They're at the forefront of treating and caring. They are the actual frontline heroes, so to say, because it scares me to even walk into a hospital to know that there are COVID patients, and then there are these doctors who are day in and day out working with these patients. And I think we need to give them our gratification, respect, and honor. Thank you, Dr. Swami, and
thanks a lot. Thanks for kind word.
All the work that you all have been doing out there. It has been you've been like a mighty hero for all of us in this time. Thank you so much. So, Doctor, are we ready? Are we ready to start this dialogue?
Yes, please go ahead.
Okay. So, guys, I'm also going to request you to ensure that you have your paper and your pen with you. As you know, Instagram has 1 hour screen time, after which this call gets disconnected. In the last 15 minutes, Doctor would take your questions. So if you have your questions, make sure you pen them down, right? Okay. So, Doctor, we're going to start with our first question today. In the last 100 days, must have been extremely crucial for you and your specialization, because Dr. Swami Pawar is a pulmonologist, a chest physician, and a lung specialist, which is directly related to this COVID illness. Okay, so Doctor, are there any cases that have really alarmed you and something that we as citizens should be mindful about?
See, the cases that we are seeing now, definitely, if as you described, the numbers are rising. but it is very, very important the citizens or the people should realize that if they are having symptoms, they should not scared with this virus. You mentioned that even you are feeling scared to come to the hospital. This COVID disease, we have to fight it together. We cannot create differences. In fact, if you take due precautions, there is nothing like you have to be scared about the COVID. The most important thing about the COVID to actually that to uh, so that the fear is decreased, that the number of cases which are recovering is really, really good, and the death rate fortunately in India is very, very low. But the people should be very, very what they should be aware or they should be doing is, if they are having symptoms, they should not hide them. If they are having symptoms, they should contact their general practitioner or their doctor, whoever is, and they should describe those symptoms. The doctor will take a call whether this should be investigated or not. This is very true, especially with the monsoon setting in, because in the monsoon there are so many elements which will mimic COVID. Like the simple symptoms of COVID are running nose, throat pain, cough, dry cough, and fever. Now these symptoms, if you see, once the monsoon starts, these symptoms can be because of simple cold also. So we should not be fearful of this disease, and as a humanity, I think we should fight it out. And if we fight it, definitely we can win this.
Thank you. So, doctor, tell us, over the months, people have done like a doctorate in the precautionary measures of COVID. What, according to you, does one need to build one's immunity back home? I mean, like you just said, it's so frightening with the monsoons. There's dengue, there's malaria, and, everybody gets a common cold just like that. Everybody gets a fever just like that. How at sitting at home, how do we understand what is this, or what do we do with? Are there any immunity boosters that we can take at home to protect ourselves? What should we do?
See, there is nothing like a separate immunity boosters. Now, as you rightly suggested, that the symptoms are so common with other common ailments which are present in the monsoon. That is the best thing, that you should consult your doctor and not self-medicate. Uh, the immunity boosters, the common immunity boosters, the best way to deal with is warm water, having natural ingredients, avoiding the preservative food, avoiding oily, spicy food, and having all fresh fruits, vegetables, your nuts, everything. These are basically immunity boosters. Yes, as you mentioned, the people have done doctorate on this. I have a very funny take on this. See, I'm a
Okay.
specialist in the lung, but I'm not a specialist in my car. I'm not a specialist in my fridge. If it is broken down, then I have to take a advice from the specialist in fridge or my car mechanic, and whatever he says I have to accept. I cannot argue with him, though I have done double PhD and specialization in the lung, but I cannot take a call on my car. So the same thing, the people who have not knowing about anything about the medicine, they should not be commenting on. That does not mean that you should not be knowing about the disease. You should be, whatever the common man or the common science knows about it, and the precautions which are being prescribed has to be followed up. The normally what we are seeing now, there are messages which have been forwarded. There is
True.
nothing like allopathy, nothing like homeopathy is best or Ayurvedic is best. Whatever things that are prescribed in their pathies for the immunity booster under the supervision of the doctor can be taken. If it is prescribed by the doctor, you can take it definitely. Yes.
Okay. Doctor, what about the children? A lot of parents watching and viewing are concerned about how do they keep their children away from something like that. You know how easily children are susceptible to a cold and a cough. And when is the time to actually go and understand that you got to go and test this person because of a cold? How do you gauge that?
See, the best thing, the very good question is that children have a natural immunity, and their immunity is so new or so new that the data also, the worldwide data also suggests that the children do not get affected very fast. This basically because the virus, the COVID virus per se, is giving us trouble because of our own immunity going haywire. And fortunately, since the children have the immunity in making, they are not vulnerable to the extent the adults are. In adults also, if we see the data and if we see the science behind it, what we are seeing is that number of males getting affected are more than the females. So the females have something like a natural immunity, not 100%, but they are doing better. Their symptoms are lesser, their complication rates are lesser. What we are seeing again in the numbers is that the elderly population, they do get the symptoms, and their disease is in the more severe form. We are seeing that the people who are having comorbid conditions like diabetes, blood pressure, heart ailments, cancers, or the people who are on the treatment, on the dialysis, they are getting the severe form of the disease. But nevertheless, even these people are fighting well with the virus and they are getting out. We have so many people who are more than 85, 90, and they have actually fought the virus well and they have gone home. So that's really a positive side.
Okay. Thank you, doctor. We, like you said, everybody is fearful of corona. No matter, we've come across people, relatives, neighbors, somebody has succumbed to the illness that everybody knows of. But still, there's this lingering fear about corona. What do you think are the myths and what are the facts that we need to follow? Are there, a lot of people say that there are stages to the virus. That some people say they can heal themselves with being at home and being quarantined at home and doing something like that. Is that true, doctor? Can you help us understand what are the myths and what are the facts of this virus?
Yes, it is very important that, see, corona is the enemy to the mankind. It is the biggest enemy to the mankind. But we cannot be fearful of the enemy. In fact, we have to fight this enemy and we have to find out ways to fight this. As you spoke about the stages, instead of stages, basically, once the virus affects an individual, there are different presentations. There are 85% out of 100 people who will get infected with corona, 85% people will not have symptoms or will have mild symptoms like cough and cold, which will last less than 1 day or 2 day and it will subside. But they can be carriers. That means though the symptoms have subsided, they may still continue spreading the disease. Now, 15% patients, that is out of 100, 15 patients will develop symptoms. Out of these 15 patients, around 10 patients will have symptoms which may be moderately severe, like breathlessness, cough, fever, but they will definitely recover. The remaining 5% patients are prone to develop the complications. Now, as I mentioned earlier, these 5% are those who are elderly, those who are having pre-existing illnesses. These are people who can succumb to the severe form of the disease. Now, means currently with we are almost 6 months from the first day of the corona case which happened in China in December, and we are getting to know science behind it. This virus is merely 6 months old. It's still an infant. So we are getting to know how this virus is doing and what body immunity or the what how the it is changing the immunity or how it is affecting our immunity, and accordingly we are getting few medicines also to treat this. So, and it is showing encouraging results also. So the fear factor, I personally feel that we should not have a fear factor. In fact, we should help out. There are directions which have been given by the governments, as you mentioned, that if whether if you are quarantined you are safe, whether you are in the lockdown you are safe. At various stages, depending on the data, the government's public health department guides them to give the guidelines. Now, as now current guidelines are lockdown in containment zones. What does that mean? Wherever they are seeing the number of cases rising, they are trying to put a lockdown or containment so that the spread of the virus is reduced. If we have lesser and lesser physical contact with each other, the chances that the virus jumping from one individual to other will be less. So the directions given by the government are basically scientific guidelines and scientific instructions which I feel the people should follow. And that is the way we can fight it out. Means if we follow those guidelines, not 100%, but even 50 to 60%, then we should be winning this war.
Okay, thank you. Doctor, there are many people who have to report to work. Businesses have to commence. The economy, so to say, has to rise. Hence, it is imperative for people to start work. Do you advise against it, or do you think people should go back to office or go back to work? And what is the safety protocol that one can follow even if they have no other option but to go back to work?
Right. As the WHO had made a famous statement, this virus is not going to go in recent times. It is going to stay with us. So eventually we have to get out of the house. We have to go to the work. We cannot just sit at home and do nothing. So now if you are going out of the home for the work, then the strict guidelines, the physical distancing is very, very important, that you should have distance with each other. Wearing a mask is very, very, very important thing. Washing hands at frequent intervals, keeping a sanitization in hand, avoiding gatherings of more than 5 to 10 people together is very, very important. You can go. The traveling is a challenge, especially in the city like Mumbai, because our public transports are overcrowded. So that is a challenge. But the government has also taken a good. I think many companies have decided that they are allowing a percentage of people to work from home, and 20 or 30% people will be attending the office, and that's the way to go. I mean, some percentage of people can resume the work with the guidelines, with the protocols, and definitely we can restart our lives.
Sure. Okay. Thank you for that. Doctor, our next question is, what challenges are the health sector facing that people should be know about, and what way can citizens do their part in making it easier for the hospital?
See, the biggest challenge in our health sector is that our population is huge. And if the number of cases rises beyond certain point, suddenly, then the number of beds and the number of patients is going to be a huge difference. The other thing is that the COVID patients, they require oxygen, and we have oxygen beds which are very, very, very limited. Though the government is doing all the best. They have facilities at Daisar Cheknaka, they have facilities as Nesco at Goregaon, they have facilities built with the oxygen and beds, but still our number of ICU beds are very less. And that's the exact reason the lockdown and physical distancing plays a very important role in slowing the spread of the virus. So the number of cases, if they are manageable, then it will be very easy for the health sector to manage them. Not only that, the number of patients who are getting affected or getting into the hospital, their recovery will be also successful because it will be manageable. Last 3 months, what we are seeing now, there has been a definitely fatigue. If you see, the policemen were on the street, they have been fatigued, the doctors have been fatigued, because there are constantly rise in the number of cases. Though we are ready to face all the challenges, but as a human you have limitations. You cannot stretch yourself beyond that. So the healthcare sector, the biggest challenge is numbers. If the numbers are controlled, we will be able to give care to each and everybody. The numbers spiral out of control, then it is very difficult, because we cannot create beds or ventilators or the trained staff. Even if you have a beds and oxygen, if you don't have a trained staff, you don't have a sisters, if you don't have the technicians, if you don't have enough number of doctors to take care of them, then it will be very difficult to manage the cases. So it is very, very important that we keep the numbers down.
Doctor, there is also this news in the papers constantly about beds not being available in hospitals and people having to wait outside in an ambulance, and some of them probably passing off even waiting for a bed in the hospital. I mean, how can somebody really combat? A lot of people say you need to have influence to get into a hospital right now. So is that true? And is
I
that
don't
something that
think. I don't
we
think. I
should be
don't think.
doing?
I don't think it is true. In fact, there are portals, there are local levels. The government has, the BMC has made attempts to accommodate, and that is the reason I told exactly in the beginning of my talk. You have to,
Yeah.
whenever you have a symptoms, you have to consult your own doctor. Take the medical help. Now, most of these patients or the news which you are now listening or you are getting in the papers, people wait. People wait for the complications to happen and then they suddenly start running around. Then probably it is very difficult to get them or to accommodate them. But if you are going to the hospital in a timely manner, I remember our chief minister also in various in Marathi interviews and Marathi messages that he gave, that please go and consult your doctor well within the time so that the complications can be prevented. But currently, I think there are enough number of beds and all patients are getting accommodated. The cost of therapy is also not very high. The cost of therapy is still under control. So there were a lot of interesting news which were given that the medicines are not available. It is not like that, because even government is trying to make the medicines available. There is definitely a difficulty in getting it, but yes, we are getting the medicines and the medicines are showing encouraging results. Yes.
Doctor, a lot of societies have started having small care centers with ventilators and oxygen cylinders and things like that. Is this a good thing? Is this advisable? Do societies follow something like that? Do you think this works?
It is yes also and no also. What does that mean? If a patient is very, very less symptomatic, he can be managed at the quarantine center with the oxygen, simple oxygen. But the moment that things get worsening or the patient is worsening, then it is better to shift him to the hospital center where the medical facility is available. So that decision is very, very important. The societies and other things mean societies decisions is really, really welcoming, because they are treating patients as a patient and not something like untouchables. They are not shunning them out. So that's a really encouraging thing. So society should do this, no doubt about it, but they should be in constantly touch with some medical facility if at all the complication happens, so that they should get a timely medical facility. Okay.
We have a question by a viewer, Glenn. He says, what's your advice to irresponsible people who can make a difference in curbing these cases?
See, the most important thing is that, as I said, it is an enemy and we have to fight it together. One person wearing mask and the other people, suppose you are traveling and you are on the road, out of 10 people, even 2 people not wearing the mask will defy the purpose. Okay, they can be carriers, they can be asymptomatic carriers, they can spread the disease. Out of those 10 people on the street, even one elderly person gets infected, he can develop a severe disease. So you don't know how the disease will manifest in each and every individual. A simple technique of wearing mask will lower the risk by more than 90%. So that's a huge number. If you wear the mask properly and keep it on for all the time when you are out, and you can actually spread the disease, stop the spreading the disease 90%, and also stop the disease getting acquired. So both the ways you are getting or you are benefiting the society. So definitely this irresponsible behavior should be curbed. In fact, we should do a Gandhigiri. We should the other people should request them to wear the mask properly, use the sanitization, not to be not irresponsible towards the others. That is the only way forward, I think.
Okay. And Doctor, the world is waiting for this vaccine. I mean, is this the only hope for relief from COVID? Are we all going to, I mean, schools are closed, everything is under lockdown, everyone is praying, waiting for that vaccine to come out. I mean, in your opinion, do you think that the vaccine is the only hope for relief from COVID?
See, in any pandemic, any viral pandemic which is so serious and so devastating, the population, until and unless 70 to 80% population gets infected with the virus, the herd immunity will not be there. Now, to get 70 to 80% of people getting infected, it will take 2 to 3 years. And we cannot have a lockdown for 2 to 3 years, right? Because if the lockdown happens for 2 to 3 years, probably we all will be bankrupt. So the way forward is the vaccine. There are very good and encouraging news coming from the media now, from the scientific fronts, from our journals also, that the phase 3 trials of the vaccine has been started in India itself. So probably we are right that by 15th August to 30th August, we should be able to get a vaccine in our hand. And if the vaccination starts, the vaccination will give us a herd immunity. And once we have a herd immunity, the complication rate will drop. See, vaccine may not prevent, because the viral diseases, they undergo constant mutation. But even if there are constant mutation, this vaccine will give us the immunity, herd immunity, and prevent the complications. That means even if after getting the virus, you are still vulnerable to get the infection, but in a lesser severe form. So you will be saved. So vaccine, yes, the entire world is looking at the vaccine, because we cannot wait for herd immunity to happen naturally, because the time period to development of the herd immunity in the world or in the community will be huge, and we cannot keep our businesses shut down for so long. So vaccine is definitely, but there are encouraging things. See, India is also, means we may get vaccines sooner than the world, the way the fast tracking of the vaccine has been done. So we may be lucky, we may get, but yes, by August or September, most of the world should give us vaccines from various countries. Yes.
I think that's a ray of hope, something that
Yes.
everybody is waiting for and looking forward to.
Yes.
Doctor, a question which came by Valini. She said, she asks that, a lot of domestic helps have been stopped from coming to our homes and paralyzed so many women who depend on them so much. What is the precaution that one can take for allowing your cooks or your helpers to come back to duty? I mean, would we ever have them back, or do we have to really make do without them till this pandemic is completely over?
See, it is a very good and valid point. It is, if you take precautions, means the domestic helps or your cooks, they can definitely come to your house. It is the same way if you are rejoining the office, whatever the guidelines you are going to follow, the cook and the maid has to follow the same guideline. What does that mean? Suppose that cook or maid is coming from the containment zone, then they should not come. That means the containment zone, whatever that quarantine period, 14 days, 10 days, if it is over, then yes, then they can come and work. They should wear mask all the time when they are working. They should keep their clothes completely covered. They should use the hand washing techniques frequently. They should wear the clothes or something which is not tight, or it should not be loose, so that it will touch to other surfaces. And they should do the sanitization. The cooking of the food, most of the time the virus is so vulnerable that it cannot tolerate the temperature more than 70 degrees centigrade. So most of our food is cooked in such a way that the virus will not be alive, or will not be vulnerable, infective in the food. So yes, and the maids also, if they are coming for the cleaning, or they are coming for, they can come, they have to just use those techniques which we are actually using in the when we go to the office. Yes, they can come.
Uh, Doctor, do you suggest any medication like any vitamin C's, or people have been saying you should have a lot of vitamin C medicines and capsules and something that can help you? Is this advisable?
See, in Indians per se, our food habits and other things are such a way that we 90% Indians have vitamin deficiency, 90% Indians have some form of protein energy malnutrition. So as a whole, we are nutriently very, very poor. So any form of vitamin, see, human body requires vitamin, minerals, all types of carbohydrates. So these are required to keep our immunity good. a particular vitamin C, zinc, or something like that is not going to protect us. We need all the vitamins. We require vitamin D also, we require vitamin C also. So it is not that only vitamin C in an excessive quantity will protect us. In fact, it can create a hypervitaminosis, which is a severe form or the toxicity of the vitamin. So whatever you are going to take, please take in guidance or in accordance with your doctor, or take it under the medical practitioner's advice. So it is advisable to take multivitamins, but you cannot overdo it, or you cannot go overboard and just take one form in an excessive quantity.
So, doctor, is your GP good enough to be consulted for all these kind of situations and questions?
100%. See, 100%, because the first time when you get the symptoms, see, coronavirus or the corona disease in itself, as we discussed previously, 85% people have got symptoms which are very, very mild. So they don't have to go to the hospitals. They just have to consult their GPs, and most of the time the GP will pick it up and treat it. Those people who are getting complications have to come to the hospital. So yes, you have to be in touch with your GP. Yes.
We have a question here by Valini again. She asks, is it advisable to get cooks to deal with raw foods or juices or milkshake?
Ideal case means whatever raw food we are creating, the juices and other things, even if we consume, and for an example, even if that food contains the coronavirus, if it goes to the stomach has got a high acidic pH. So that high acidic pH is good enough to neutralize or destroy the virus. Please remember that whatever the scientific guidelines have been given, if you actually give a thought to it, the virus is so vulnerable that 20 seconds hand washing will destroy the virus from your hand. The virus is very, very vulnerable and dangerous when it actually goes and attaches to our mucous membranes, which is nose, mouth, and the eyes. So the entry points are these. So apart from these entry points, all means there are no other entry points. And even if the virus is in the raw food, if you are consuming that food, the stomach acid is enough to take care of the virus.
Okay. Well, okay. Friends, if you have any questions for doctor, you can pen them down. You can type them in the comments section right now, and Dr. Pawar would be happy to address them. So in case you're listening to this conversation, and if you have questions, kindly pen them down. Doctor, would you like to tell us about any case at the hospital that has been difficult, or that has been something that you all have cracked very easily? How has been the situation at the hospital?
See, most of the patients who are requiring the hospitalization have moderately severe disease, because the simple disease we are not admitting, and they are being taken care either with the home quarantine or at the quarantine centers. Moderately severe diseases, most of the patients, once we assess with certain x-rays and the blood test, we assess them and we categorize them into different stages, and depending on that we start the treatment. Most of the patients do respond to these treatment within 5 to 7 days, and the average discharge happens on the 7th to 10th day with no symptoms at all, and people are recovering very nicely. The difficult cases which we actually manage, means we have taken care of a lot of healthcare workers also. In fact, we have taken care of elderly people who were more than 90, 92, and they have made it very nicely. Means they have gone into really, really bad phase. They have gone onto the ventilator. There was one lady who has stayed with us almost 20, 21 days. There was one uncle who had stayed with us for a long time, 20, 21 days, but finally recovered and went home safely. So there are a lot of cases, means, and what I like to I liked about them is that in spite of having such advanced age, having comorbid condition, they have a spirit to fight. They never gave up. They have cooperated with all the treatment modalities, with the ventilatory supports, and so many injections and so many so many blood tests. They have cooperated very well. So as I said, the fear factor, if those elderly people who are more than 80, 90, they can fight out, then why as a people, as a whole, they should fear about this virus? In fact, they have a positive attitude that, see, this virus has come, this is there, nobody can deny that now. It's a fact now that the virus is here. So we have to have a strategy to deal with it. So this strategy is through the cleanliness, through the sanitization, through the wearing the mask, and the first step is to prevent the spread. But even if we fail at the first step and the disease happens, there is nothing to be panicked, and it is very important to report your symptoms to the doctor and let the doctor decide that in which category you are and what is the best for you, whether you require to be treated at home, whether you require to be sent to the hospital, whatever that, whether you have to be tested or you don't need a test, because the symptoms might be a simple thing and you may not need a test at all. So that is very, very important. That fear factor in the mind has to go. So the people are recovering, people are living, people have recovered well, they have gone back to their work also. There are so many doctors who have suffered, gone on ventilatory support, even our own doctors, and they have come back and joined and started treating the patients also. And that's such an encouraging thing. Our own radiologist suffered. He was in the hospital for 25 days. The radiologist means somebody who does the sonography and reports the x-ray, and so he has suffered, but he had a very good fighting spirit, treated, recovered, and joined back also. In fact, he was so keen to join, we had to tell him that don't join back, just take rest and then come back. But he was very, very keen to join. He joined back. So that's really encouraging stories for us. The healthcare workers are fully prepared to take all the challenges. What we require from the people, the initial stage of this pandemic, if you have seen the UK news and BBC news, there was a message written very clearly: save NHS. NHS is their healthcare system. So the people should have an attitude to save the healthcare workers. They have to cooperate with the healthcare workers. So how they can cooperate with the healthcare worker? The biggest thing that they can do is show the faith. That is very, very important, because we want to get rid of this disease. We want to get out of it. But having faith is something which is really, really important factor, and patience, because it is going to take time for the person to come out. But with the faith and patience, definitely we can come out of this.
Okay. We have another question. A lot of people, uh, lot of people are waiting for normalcy to be restored. Is mask sanitization going to be the new normal for at least a year or so?
This may go on for a long time. It may go on for 1 year. It may go on for 2 years. Mass sanitization is really, really important. But the meaning of the mass sanitization is that everybody should be using this hand washing technique and sanitization technique. If you ask me for the spraying of the buildings and other things, probably it's not necessary. If you can take care of this, the individual level sanitization, then probably we don't require to be doing all this spraying in the streets and spraying in the buildings. So yes, this is going to stay. This is going to stay at least for 1.5 years probably. Yes, but on the other hand, what I feel is that we Indians have a lot of bad habits, like spitting in the street and littering all around. If with this coronavirus thing, if we can actually imbibe good sanitary practices, what is wrong in that? In fact, in long run, it is going to keep our roads clean, our locality clean. It will decrease the number of infectious disease. India is a capital of infectious disease. We have a more number of TB cases than the coronavirus, and we have more number of TB deaths than corona deaths. So in a way, this sanitization thing, I don't see it as anything wrong. In fact, if we can have good habits, then we should follow them for a long time and not restrict it to only 1 year, 2 year, 3 years. Why not to do this for a long time? We may not wear the mask all the time after 1.5 years, but yes, hand washing techniques, not spitting, quitting the smoking, tobacco related product, ban on tobacco related product, that will help us in a long run.
There's another question, doctor, by Eldridge de Lima. On a full flight, if there is a positive person but is wearing a mask, is it risk to the other passengers because of the air?
See, if the person is wearing the mask, that to a N95 mask or a simple mask, and he is in the flight and he is wearing that mask all the time, then the risk to the passenger is very, very less. See, in airlines, typically to save the fuel and energy, the air is recirculated. So this recirculated air can be a risk if the person is open. That means if he is coughing. The respiratory viruses or respiratory diseases like tuberculosis, coronavirus, influenza, they spread with the droplet. Droplet means whenever you are coughing, whenever you are sneezing, whenever you are speaking, there are small droplets which actually emits from the mouth. These droplets contains the viruses or the bacteria or the TB, and these can spread in the environment, and they can go to the next person. Whenever the next person inhales, that can go inside the lung and that can infect. So in a full flight, if the person is using the mask, then the risk is minimized, really, really, really less. Yes.
So there is no, people are afraid of even touching the dead body of a COVID person. Like we've heard news of people saying, there is the virus that's also on the dead body. Is that true, doctor? I mean, a lot of people are shunning away from this.
No, see,
Things
see
like that.
the reason why now, see, there is a fear for that, and the patients who are dying because of the COVID, there is a certain way we are trying to dispose the bodies, because most of the rituals that we are going to do, the secretions from the body will contain the virus that is there. So to prevent that, the rituals has to be curtailed, and we have to do it in certain manner. So we can do the rituals but in a certain manner, so that there is no contact with the dead body, and we have to give due respect to the dead body and do the whatever normally how we give the respect to them, and we can dispose them. Yes.
Doctor, we have another question here from Valini. Are there any studies to show? Are there any studies to show if a person has contracted the virus once, is the person immune going forward?
See, in viral diseases, it is always that once you have been infected with the virus, you will get, and if you have recovered, you will get a lifelong immunity, and you will not get that virus reinfected again. The only thing in the viruses is that these viruses keep on mutating very fast. So you may not get the same strain again, but you may get a different, or the brother or sister of that virus which has mutated can reinfect you. Yes.
So, doctor, recently they said that they've discovered that the sugar levels of people who are non-diabetic also have started increasing with COVID, and that's a recent finding that one of the hospitals, I think Hinduja Hospital, mentioned. Is that alarming? I mean, why have you all found out what is the reason behind this?
See, there are a number of things. As I said, the virus is just 6 months old, and as we are treating, as the number is increasing, we are getting various facts and figures about the virus. One of the reasons why the sugars can be high is that we are using a lot of steroids also to treat or to suppress the immunity, and steroids can give a transient rise in the sugar levels. But yes, these are the initial studies, and these are the what we say the evidences which we have got. This requires more and more numbers to confirm those things. But yes, this is true that the sugar levels are going on the higher side, maybe because of the treatment options, or maybe because of the virus. That requires a confirmation though.
Great. Uh, Doctor, I think you've covered so much for us. I really want to say thank you. This is the last call for questions. In case you have any question, please feel free to type it down in the comments section. We've covered most of our questions, Doctor. Is there something that you would like to tell us? I mean, on this whole thing, has it changed lives for you all? It has changed lives for all of us in so many ways, and to people like us, we are like locked down, and people are scared to go out. People are scared to buy groceries. People keep groceries away for about 2 days till they can touch it. There's so much of this uncertainty that has built up in our lives, and we're just praying and hoping for the best that someday we will see we will see sunshine and we will see a brighter day. So is there something that you would like to tell us, something that you would like to encourage or give us hope with?
Definitely, because see, the virus has, or the entire outlook towards the virus has evolved. See, initially, even as a medical fraternity or as a pulmonologist, we were very uncertain about how this virus is going to be in Indian population, whether it is going to be equally devastating. Is it going to be equally devastating as European countries or the US? The death rate is alarmingly very high in those countries. But fortunately, till now, whatever death rates, whatever the recovery rates are very encouraging, death rates are very low. So it is really encouraging. This entire thing is now, even as a medical fraternity or even as a scientist, as a researcher, we all are on the learning curve. We are getting newer and newer information. The entire, means this is the one situation probably the entire world is trying to get a breakthrough to get out of this viral illness. So it's a huge thing. Means consider everybody, means most of the researchers, scientists, everybody, the government machineries, everything is working out to win this situation. So that's such an encouraging thing. Means I don't remember the entire world unifying, having on the same page to fight against something so unanimously. So I think that's really encouraging, and we should be having faith in mankind that it will definitely come out. We should have faith in the God that it has been kind enough to give us a strain which is fortunately not very much deadly, or which is not creating the same havoc it has created in the US or UK or in the Italy. So that's really encouraging. Having said that, the mistakes, means whatever mistakes they have made, they are learning pearls for us, and probably we should not repeat those mistakes. And if our population or if our people understand that well, then probably we will see, as a we are a developing country, these are developed worlds. Even we have gone there for the training, and we have been in their systems in France and in Germany. They have marvelous training centers, they have marvelous hospitals, they have such a nice infrastructure which probably Indians cannot match for next 20 or 30 years. In spite of that, they cannot, or they were not able to contain the death rate. Fortunately, even with our infrastructure, our population, we are still lucky enough to control our death rates. This is such an encouraging thing. Means we should be proud of ourselves that in spite of having a developing country, we are fighting it so well. So there is definitely a silver lining to this. If at all we are able to launch this vaccine by 15, then we will be probably the first country to commercially use it, and that will be such a breakthrough for us. That we will be, the India will be gifting, or India will be leading the way for the medical science. So that's really good thing. So we should have positivity from this. This has given us time also. Those who were at home also, they might have found out some hobbies or something else. So probably we should, instead of getting depressed with all this situation, we should try to how we can come over it, how we can develop our own energy levels, how we can help the healthcare workers, how we can help the hospitals. There were so many good news which were coming, that the Mumbai has famous Ganeshotsav festivals, and many leading Ganeshotsav mandals have come out and they said we will not celebrate the Ganeshotsav, and we will channelize our efforts, channelize our entire energy for the plasma donations and to give the society its due. So it's such an encouraging thing. In fact, nobody would have dreamt about it, something like this can happen. But there are so many nice and so many encouraging decisions which are coming out from all over. So that's really great. So there is definitely silver lining, and we are as a population, we are actually together. I don't think everybody is on the same page. Otherwise, we won't get this kind of news, this kind of encouraging news to us. So I think this is a good thing which has happened. Definitely.
Yeah. Thank you, doctor.
Thanks, sir.
We have a few more questions. So we have 5 minutes. So we can take questions only for the next 5 minutes. Arthur asks us, when will it be safe to visit India?
Uh, See, nobody can answer that. As I said, if the vaccine is available, and if the herd immunity is there, then probably everything can normalize post September, October, November, December. It gradually should normalize. But it is very difficult question to answer because nobody has answer at this juncture, because it's not cannot predict.
Conrad asks us, could getting breathless be a symptom of COVID-19, or is it due to wearing a mask for a long period of time that someone can feel breathless?
See, breathlessness is again a relative symptom. Something like if somebody climbs 3 floors and gets breathless, slight breathlessness, which we get, it's a natural breathlessness. And yes, after wearing a mask, you feel slightly more breathless at a lesser workload. Means maybe after first floor you can start feeling breathless. But the breathlessness in COVID is very different from the breathlessness which you get while exertion or any other thing. So the
So
COVID breathlessness, yes. So this breathlessness is very relative, and only breathlessness cannot be the symptom of COVID. Normally, you do get cough, cold, you get runny nose, you get fever. So very rarely you will get a breathlessness as a pure symptom of COVID. So
fantastic. Okay, and doctor, is it essential, as Elridge, why do you have to sanitize vegetables and other things once you get them home? Is it really
I don't think so, because see, if you wash the vegetables properly, whatever you are bringing from the outside, and washing your hands is very important. Not touching your face again and again, especially eyes, nose, and mouth area. That is very important. So separately sanitization for the vegetables and other things is actually not necessary, because see, this alcohol based or whatever you are using for the sanitization is basically can be toxins and can be consumed by the people. It can remain in the food, and it can again cause a poisonous effect on your body. So you have to be careful what you are using for the sanitization also.
great? Doctor, I think we're almost reaching an hour. I just think you've answered so many questions, and I'd like to sum this up really. A takeaway from what we've learned from what you've told us today is that the very important thing is not to be fearful. It's also to have faith in the doctor, faith in the system, and to never give up. And finally, it is imperative to wear a mask. That's one of the best things that you can do, and sanitize your hands at all times in order to stay away from this disease. I don't think we need to dread it and make it like a monster in our face, but we need to fight the enemy, like you said. So I think it's been a fantastic time, doctor, and I'm so grateful to you because I know how busy you've been, guys. I've been unable to get through doctor because he's been in the ICU. We've not even been able to do a mock or, even make a call for more than like 5 minutes in the last few days after we've discussed this. But I think I'm so grateful to you, doctor, for giving us this 1 hour. I'm really thank you to Dr. Ryan, to and the entire team at Thunga Hospitals. We express our deepest gratitude for your invaluable contribution, doctor, that you've been doing to the society, to our nation, and to all of us here. Thank you so very much, doctor. May God
Thanks,
bless
thanks,
you,
thanks a
and may
lot.
the
Thanks a lot.
force with you blessings and blessings. Thank you so much, and
Thanks a
thank
lot.
you
Thanks.
everybody else. Thank you, doctor. We hope we can make life easier, and we hope that you all are relieved from this, because I know how hard you have been working in the last so many days. Thank you so much. Our
Thanks,
time is
thanks.
now, and thank you everybody for coming on. Please be there, waiting and watching at my space till we meet more people and we help you learn something every week. Thank you very much. Thank you, and thank you, Doctor, once
Thanks.
again.
Thanks.
I also
Thanks.
want to say thank you to Elrich Delima, who helped us get through Doctor, and to Glenn,